I'd like to show you some in vitro evidence that demonstrates how debridement with Debrisoft works. So it's not only the key question how the debridement works, but it's the question of how to demonstrate how debridement works. So first of all, I think you all know Debrisoft. Who doesn't? No? Everybody knows it. So you've probably seen this one. So this is the monofilament microfiber fabric in action, and this is a scanning electron microscopic image of the fibers. So it is thought, in theory, that these flexible fibers reach all areas of the uneven wound bed, and then the fibers will loosen the debris and the exudate from the wound. They will take it up, and when you take the Debrisoft off after you've wiped your wound, then you will get a clean wound bed because the fibers absorb and bind the loosened wound coatings and keratosis. So you will achieve a highly efficient result. And I've got here some electron microscopic images of the Debrisoft before and after treatment of a wound. And there you can see highlighted really in the fibers the protein slough, bound bacteria, and everything. But is this enough evidence to show that debridement with Debrisoft really works? Well, if you've got a wound, then you can use Debrisoft and be confident that you have achieved a very good result. But you will not have a wound that will look exactly the same, so yet you can say Debrisoft works better than any other product, for instance, gauze. So we tried to design a wound cleansing model so that we really can compare efficacies of debridement methods. So this wound cleansing model consists of a glass plate coated with a thick protein crust that is stained with hematoxylin to mimic the proteins in the wound. This is then put back in the holding device. We have the Debrisoft pad or cotton gauze pads that are attached to a weight, and this is then put in the model, pulled over the glass plate, that's our wound, in a constant velocity. So this is really impartial. I can't manipulate it. Nobody can tell me, oh, you just pressed harder with this one and less hard with that one. So you can then take the glass plate, photograph it, and read it out. Then the image is converted to a binary image for evaluation so that you can see, okay, here there is still a protein crust, and this is a cleansed area, and then you can put this in a diagram. So if you use a low protein content, I can tell you, okay, gauze and Debrisoft work partly the same. If you increase the protein content, you see that cotton gauze slowly fails. Debrisoft still achieves a very good cleansing efficacy. Well, if you increase the protein content further, then both fail. But this is just wiping 5 times. You wouldn't just stop wiping your patient because you fail after 5 times. You would just go on. So, and as you can see here, if you increase the wiping times, of course, you will achieve a very high cleansing efficacy with the Debrisoft. And still, even if you increase wiping with cotton gauze, you will not get a better result. But you have a cleaned area with the Debrisoft. So in conclusion, you can achieve significantly higher cleansing efficacies with Debrisoft compared to cotton gauze. And from a scientific point of view, we can adjust the model by varying the protein content to various wound conditions. So that wasn't enough to know what's the efficacy. We wanted to know what's the capacity. So this we did with using 4 glass plates wiped in a row. So we would go over one plate, then the next, and then the next. And as you can see here, the results, well, the first plate for the cotton gauze was quite good, and then it simply lost its efficacy. And Debrisoft, you see that one plate after the other, same as the one before, all cleaned. And you can also see, Well, the cotton gauze pad is still, well, there's not much room for more. You can see a bit more room for the Debrisoft. So put in a diagram, as you can see here, we have a significantly high cleansing capacity for the Debrisoft, as it retains its efficacy while wiping 4 plates, and gauze quickly lost its effect. So, well, you'll probably not only find proteins in a wound like this, there's also going to be bacteria, most likely in a biofilm. And you probably all know this slide. Biofilms will grow on any surface that they are able to attach to, being it biological or a glass plate. And this we used to culture biofilms ourselves. And you can see here some microscopic images stained with cytonine propydium iodine solution here and a DAPI solution here. And simple as the protein glass plates, we use those in the model. And here you can see the results for the cleansing. We have, if you look at it, the first plate, second plate, they're quite similar. Cotton gauze performed very well. But you can see a trend downward, and starting with plate 5, gauze did lose its effect while Debrisoft retained a high cleansing efficacy. So, and if you have a look at it, you have here a free glass plate, no more biofilm on it, and I would guess that you could go on further, but the cotton gauze was no longer able to clean the glass plates that we used in this model. So here also Debrisoft exhibited a significantly higher cleansing capacity compared to cotton gauze. So in summary, the developed wound cleansing model showed that significantly higher cleansing efficacies were obtained for Debrisoft with regard to the BSA content, but also for the removal of bacterial biofilms. And we can say that from the models we've used, we would think that it will exhibit a significantly higher cleansing capacity, which is retained over wiping several plates, while gauze did lose its effect. So Debrisoft presents a non-invasive and therefore almost pain-free alternative to other techniques and can be performed without major expenditure in terms of time or materials. And this new technique should provide a valuable tool in the treatment of patients with chronic wounds to improve the quality of life as well as to save costs. I am pretty sure that's Joe going to tell you more about it. And that leaves me to thank you for your attention.